Hello and welcome to UZREPORT World News with me, Brenton Tarrant. According to the most recent data, the total number of confirmed infections in Uzbekistan has reached 65 as of noon of Thursday. Most of the new cases were imported and include family members of the infected arrivals. The updated statistics for Central Asian countries is as follows. 65 infections in Uzbekistan, 97 in Kazakhstan, 44 in Kyrgyzstan and 84 in Afghanistan. Tajikistan and Turkmenistan have not yet officially reported of any COVID-19 cases. Meanwhile, Afghanistan has reported 2 deaths and 2 recovery cases. 2 people have recovered in Kazakhstan and 5 patients in Uzbekistan are showing promising signs of recovery. Senior people are among those most at risk of severe illness from the coronavirus. According to the global statistics, more than 2,000 coronavirus-related deaths have been reported among people aged over 70, of which more than 70% are men. Therefore, the government of Uzbekistan is urging the older adults to stay at home. However, not all of the people in their pension age are rushing to comply with these recommendations, many explaining it with the fact that they need to visit pension offices to submit retirement applications and claim their pensions and benefits and tackle other related problems. Can all these issues be resolved remotely? More in our next report.
Currently, the number of pensioners in Uzbekistan is about 7–8% of the total population. Some of them are quite independent and active. They pay all the bills and run all errands by themselves. However, in the light of quarantine, it is not recommended for people aged over 65 to leave their homes, because they are some of the most vulnerable to the effects of COVID-19. Therefore, the pension fund urges all elderly citizens to stay at home and do things remotely. For example, the fund has launched free texting services that provide information about raised pensions, benefits, and etc. In addition, paper-based retirement books have been replaced with electronic ones, and all information about new employment of resignation can now be submitted online.
The government of Uzbekistan has instituted a force majeure policy for businesses in case of failure to fulfill contracts as a result of the coronavirus spread. In order to mitigate the negative impact of the coronavirus pandemic and global crisis on the national economy, the Ministry of Investment and Foreign Trade has been instructed to issue force majeure certificates to business entities upon their request. The process of obtaining a certificate takes 1 day in case a force majeure is proven to be associated with coronavirus. The economic pressures resulting from the spread of the coronavirus and the lower oil price are credit negatives for CIS banks and could result in negative rating actions, Fitch rating says. Fitch has received banking sector outlooks to negative for 7 of the 8 markets it covers in the region: Russia, Ukraine, Kazakhstan, Armenia, Azerbaijan, Belarus and Georgia. The banking sector outlook for Uzbekistan remains stable.
The degree of pressure on banks will depend on the extent and duration of economic slowdowns, the specific exposures of national economies and external finances, the policy responses of national authorities, and individual banks' business profiles, risk exposures and financial metrics going into the slowdown. Whether this pressure translates into negative rating actions will also depend on the availability of state or shareholder support, which underpins most bank ratings in some markets. Banks with B ratings usually have a greater tolerance for impairment of financial metrics than those in the BB and BBB range. The stable sector outlook in Uzbekistan reflects the predominance of state-owned companies in loan portfolios and of state-owned lenders in the banking system, and Fitch's expectation of continued government support for these entities.
Uzbek banking regulator has announced additional measures to mitigate risks associated with the loan payments affected by the spread of the new coronavirus. The central bank in particular recommends that all credit organizations, upon requests from borrowers, provide a grace period and extend deadlines for final payments on loans until October 1, 2020 for all those whose activities were negatively impacted by the quarantine. No penalties shall be imposed for deferred credit debt and no collateral for loans shall be taken during this period. Due to the quarantine and social distancing protocols in place countrywide, credit organizations have been asked to create an online system for applications for deferred payments. Postal Service of Uzbekistan has announced that it will continue to accept and deliver mail and parcels despite the suspension of all domestic flights, though some shipping delays are expected due to delivery by ground transportation only. However, the Postal Service has pledged to do all it can to ensure smooth and uninterrupted service. Deputy Chairman of State Tax Committee of Uzbekistan spoke about measures undertaken to control prices during the quarantine period. He also responded to questions about tax payments and operations of shops and bazaars.
During quarantine, we have created a control center that is in charge of price regulation. 2,400 employees are involved in this. Each point of sale is monitored to ensure that no one deliberately raises prices. According to statistics, the call center has received a total of 7,688 complaints since the start of the quarantine. All of them have been promptly addressed. Preventive work is carried out to ensure that the potential culprits do not take advantage. The typical acts that would potentially put into play are mainly price increases and illegal business activities. Another pressing question was about measures being taken to assist entrepreneurs during this lockdown, since they won't be making sales. Making tax payments may prove to be a challenge for them. What is being done to help them? Of course, there are benefits. This is the protection of entrepreneurs, the allocation of individual funds, and etc. Now that sales have decreased, the social tax collected will be 50% less than usual. The next question was about bazaars. What happens when they close? There are worries that closure of bazaars and shops will cause food prices to rise. The specialist said that the operations of shops and bazaars will not be suspended and prices will not rise. Additionally, pharmacies that are caught overcharging will be given a fine of $150 for the seller, and the pharmacy itself will lose its license. The demand for non-cash payment has seen a sharp increase during the quarantine. Ulukbek Makhmudov, representative of the central bank, advised citizens to use credit cards instead of cash. We do not recommend using cash. This way you can catch the infection, since nobody knows who touched the money before. Almost all stores now have terminals. People can also pay for public and interactive services through mobile apps. In addition, all banking services have become remote, and the institutions themselves are disinfected twice a week. The expert also noted that all international transfers operate without interruptions. Mumin Ibodov, press secretary of Agency for State Asset Management, briefed about conditions created for entrepreneurs. All opportunities are created for the convenience of businessmen. After all, many of them have suffered. This includes tourism, sports, training centers, and so on. Under current circumstances, they will not pay rent fee. Moreover, investment commitments cannot be fulfilled on time due to the quarantine. No penalty will be charged for delay.
We have overcome many pandemics and crises before. We will overcome this one too. The question is how large a price we will pay. Already, we have lost more than 16,000 lives. We know we will lose more. How many more will be determined by the decisions we make and the actions we take now. Asking people to stay at home and shutting down population movement is buying time and reducing the pressure on health systems. But on their own, these measures will not extinguish epidemics. The point of these actions is to enable the more precise and targeted measures that are needed to stop transmission and save lives. The time to act was actually more than a month ago or 2 months ago. That's what we have been saying. But we still believe that there is opportunity. I think we squandered the first window of opportunity, but we are saying today in my message, I made it clear that this is a second opportunity which we should not squander.
A total of 472,529 COVID-19 cases were reported globally as of Thursday, according to the situation dashboard by the World Health Organization. The global death toll from COVID-19 has climbed to 21,304 as the virus affected 196 countries and regions. Outside China, the number of confirmed cases has exceeded 330,000. In lockdown Italy, the worst-hit country outside China, the coronavirus pandemic has claimed 7,503 lives as of Thursday, and the cumulative total number of the confirmed cases reached 74,386, with a daily increase of 5,210, according to the new data released by the Civil Protection Department. Among the current confirmed cases, 3,489 are in intensive care. A total of 9,362 people have recovered from the disease so far. Spain, the second hardest hit country in Europe only after Italy, registered 738 fatalities from the coronavirus over the past 24 hours, bringing the death toll to 3,648 on Thursday.
Indonesia's government is in a race against time to contain the coronavirus, urgently building new hospitals on its islands and converting a massive stadium into a makeshift hospital. The country of 260 million people is the fourth most populous in the world, but it is lacking enough hospital beds and medical staff, leaving health experts worried that the country could become a new virus epicenter. The country has confirmed over 600 cases so far, but doctors told Reuters that the health system was already under strain. One doctor said she had to wear a raincoat because there were no coveralls available. Indonesia's health system ranks poorly, with only 12 beds and 4 doctors for every 10,000 people. Compare that to the likes of South Korea, that has 6 times the number of doctors for a country with only a fraction of Indonesia's population. Indonesia's 19,000 islands, spanning over 5,000 kilometers, also provide a massive geographic hurdle for the central government. On one of the islands, Galang, all hands are on deck to get the walls up for Phase 1 of a new hospital, to be completed in just 3 days. And in Bekasi, east of capital Jakarta, a stadium has been turned into a quasi-hospital, with officials setting up beds and test stations in case local health institutes are overwhelmed. As few as 2% of Indonesia's infections have been reported, according to the London-based Center for Mathematical Modeling of Infectious Diseases.
Russian President Vladimir Putin on Wednesday postponed a nationwide vote on constitutional changes that would allow him to extend his rule due to what he said was the worsening global situation with coronavirus. The vote on changes that include scrapping a constitutional ban on Putin running again for president in 2024 had been planned for April 22. Already approved by Parliament and Russia's Constitutional Court, the changes would reset his presidential term tally to 0. That would give Putin, who has dominated Russia's political landscape for 2 decades, the right to serve 2 more back-to-back 6-year terms. We see how severely the coronavirus epidemic is developing in the world. In many countries, the number of cases is continuing to grow. The whole world economy is under threat, Putin said in a televised address to the nation. In the meantime, Russia is speeding up the construction of a new infectious diseases hospital on the outskirts of Moscow to finish the project by mid-April, the capital's vice mayor Andrei Bochkarev said on Wednesday during a visit to the construction site. The hospital is intended for a maximum of 630 inpatients and is now being supplied with medical equipment partially purchased abroad and partially brought in from other medical centers in Russia, he added. Russia has reported 840 cases of coronavirus, with Wednesday seeing its sharpest increase in new cases. At least 3 people have died.
New Orleans is on track to become the next coronavirus epicenter in the United States, dimming hopes that less densely populated and warmer climate cities would escape the worst of the pandemic.
And quite sadly, the number of cases in Louisiana continues to rise more drastically than we would like.
Governor John Bell Edwards said on Wednesday that if predictions were correct, the hospitals in New Orleans would struggle to manage past next week.
When we're pushing out the date in Region 1 down around New Orleans, where we think we might exceed our capacity to deliver health care to COVID-19 patients, it would be in the April 4th or 5th timeframe.
New Orleans is the biggest city in Louisiana, the state with the 3rd highest caseload of coronavirus in the United States, behind New York and Washington state. But New Orleans currently has the highest growth rate for infections in the world, leaving many wondering how it spread so rapidly here.
We are in the midst of this.
Dr. Rebecca G., who until January was the health secretary for Louisiana, says it was Mardi Gras.
What we need to focus on now is the fact that we are several weeks post Mardi Gras and we are starting to see that spike. And what the governor has indicated is that we're on a path to look like Italy, and we need to prepare for that. Certainly the measures that we've put in are very stringent. The governor and the mayor have been very clear about stay home to save lives. That being said, we're not going to see the impacts of those measures for a week to 2 weeks, because that's how long the virus takes to create symptoms.
Some 70% of all Louisiana's confirmed cases to date are in New Orleans. Dr. G, who now heads up LSU's Healthcare Services Division, notes that Fat Tuesday fell on February 25th, when the virus was already in the United States, but before the CDC and national leaders raised the alarm with the American public.
We need a better national strategy around how we get resources to those who need it, where they need it, when they need it.
New Orleans could well be the first major domino to fall in the South, starting a chain reaction in other metro areas in the region, according to the dean of the National School of Tropical Medicine at Baylor College. It's a serious concern for Houston, the fourth largest city in the country and a major center for the oil industry. Houston and New Orleans have historically strong links, made even more so by an influx of New Orleans residents into Houston following Hurricanes Katrina and Harvey.
The Australian man accused of carrying out New Zealand's worst mass shooting in history pleaded guilty to 51 charges of murder in a surprising move on Thursday. Brenton Tarrant had been in police custody since March 15 of last year, when he was arrested and accused of using semi-automatic weapons to target Muslims attending Friday prayers at 2 Christchurch mosques. On Thursday, Tarrant admitted to 40 charges of attempted murder and 1 charge of terrorism. Tarrant had previously pleaded not guilty, but he switched his plea unexpectedly. That change now renders the 6-week trial that was due to begin in June redundant, and the court will instead move directly to sentencing Tarrant on all 92 charges. New Zealand Prime Minister Jacinda Ardern, who has stuck by a pledge not to name the gunman in public, said she was relieved to hear the news.
The whole nation, but particularly our Muslim community, are being spared from a trial that could have otherwise acted as a platform. Nothing will bring their loved ones back, but this is a small reprieve.
Tarrant, who faces a lifetime prison sentence, had posted a social media manifesto ahead of the attacks, referring to white genocide, a term used by white supremacists to describe the growth of minority populations. Tarrant's lawyers did not respond to a request for comment.
And this was our last report for today. Please take care of yourself and goodbye.